Welcome back. Well, as the COVID-19 infection rate drops, there's talk that government might ease lockdown restrictions soon. For more on this, I'm joined by Professor Mosa Moshabela, UKZN's Acting Deputy Vice-Chancellor of Research and Innovation. Prof, let's try this again. So there is talk of lockdown regulations being relaxed. Is it the right or wrong move?
Good evening, Shahan, and to the viewers. It's difficult to tell at the moment. My sense is that considering the fact that we've been in lockdown for such a long time, it's possible that the population needs some sort of respite. I also think that it's possible that there's sort of pressure from an economic point of view to increase population activity. But my view is that we would have been better off focusing on driving up vaccination and delaying relaxation of the lockdown levels to level 2. Even though some are arguing that there isn't a big difference between level 3 and level 2, which I'm sort of inclined to agree at times. It just depends on how people are going to respond. But if we accept that there could be a difference, I would say that it would be better to focus on driving up vaccination now, extending it for a little bit longer, and then relaxing it at a time when it's a lot more safer to do so.
Yeah, because the Deputy Health Minister is raising concerns, saying that only 2 provinces are officially out of the third wave, so it might be too early to actually make this move. You agree with that?
Yeah, no, I think so. I think that at the moment, I'm not aware that there is a lot of pressure from the public for government to relax from level 3. It may be coming from other quarters that I'm not aware of. But I think that, if we were to wait for KwaZulu-Natal and the Eastern Cape to settle down a lot more in terms of infections, then, we could actually, in the meantime, be pushing other priorities, including vaccination. Other than that, I really don't understand why there is a sense of urgency. I don't quite see it. I think that there's a lot more urgency to prepare for sort of December time, prepare for any eventuality that may come. And that really depends a lot more on vaccination drive.
Yeah, so there's been a slight increase in cases over the past 48 hours. Anything to worry about, or are we likely to see a further decline?
No, it's not anything to worry about. In general, we are seeing a downward trend in terms of the average 7-day average. And it's quite positive. In terms of positivity rate, we are also seeing a decline, which is also quite encouraging. And we are also looking at the absolute numbers for KwaZulu-Natal and Eastern Cape, which are the 2 provinces that we were worried about. So the trend is looking good, Shahan, and I do think that it does, in a way, it is tempting because it's a lot better than what it was to keep relaxing further. But I think that if the public can hold out for a few more weeks, it could be of benefit to society as a whole to hold it out a bit, especially because there's still concerns around new variants. So it might be good to just kind of delay and not rush into relaxing restrictions too soon.
And if that were to be the case, would that delay a 4th wave?
My view is that we've seen the benefit of the restrictions in terms of limiting movement. We're seeing the benefit of curfew. And I think people get used to these patterns. And when you're taking people in and out of these restrictions, it can be disruptive to people's lives. I do think that if we were to delay the restrictions and carry on with the way that they are at the moment for a couple more weeks, or a few more weeks, and in the meantime push up the benefits of vaccination, Whether the fourth wave comes later, it's not going to matter so much. We saw the third wave, for example, was predicted to come somewhere around end of April, but it was delayed by a month or so. And that delay, in a way helped a lot in terms of coverage of vaccination for healthcare workers. So whatever delay we can muster while we push up vaccination, it will be a win for us in many ways. And so I do think that we need some sort of social contract, social compact for that to happen. If there is continued restrictions, but the vaccination drive does not go up, it does not offer the added value or benefit to the public. But if indeed we are able to boost it up, it will help. And I must say just one thing, Shahan, that vaccinating a lot more people when the infections are low is of so much benefit, because we're not going to have a lot of people being concerned about people dying, because a lot of these people were also infected with COVID-19. It's not ideal to drive up vaccination during a surge of infections.
Yeah, I totally get you. So let's talk about the upcoming elections, because the Constitutional Court says that has to happen by the 1st of November. Do you reckon that's going to cause some problems in terms of the infection rate?
I think that I can't speak from a technical point of view. I can speak generally from a public health perspective. I do think that the campaigns leading up to elections are going to be a bit of a problem, especially because we are concerned about the emergence of variants. If it was just a matter of election day, then maybe we could say that there's a risk benefit that we could absorb. But we are talking about campaigns leading up to that. We are talking about registrations and a number of other activities leading up to that. And so that's where really the problem is going to come from, especially because then, opportunities for super spreader events are going to increase.
All right. Thank you so much for your time, Prof. I really do appreciate it. That is, of course, Professor Mosa Moshabela from UKZN.